Thank you.
Just a second.
Yeah.
Juste pour vous, il suffit de le mettre et en principe vous m'entendez. Attendez-moi, juste permanissez. Il reste 2 écouteurs.
Okay. I wanted to begin by mentioning that ISPS, the International Society for the Psychological Treatments of Psychosis, the original abbreviation was for the International Symposium on the Psychotherapy of Schizophrenia. We've dropped the name schizophrenia because it's gotten such a depressing name to it, where people often think that to have schizophrenia is basically to be doomed to psychosis for life. It's like a diagnosis that's experienced as a thing of hopelessness, which isn't accurate, but still people are left feeling terrible when they hear that. Our next meeting is going to be March 18th through 22nd, people coming from all over the world to New York City. I have these cards available for people who are interested in looking at where the program stands now. And if you're interested in submitting something, we've extended the deadline to November 1st. And the theme is relationship and experience in psychosis and international dialogue. They're calling it From DNA to Neighborhood, Relationship and Experience in Psychosis. So see me afterward, and I'll give you one of these cards if you're interested. And it does look like we'll have some of our program live on the internet. So if you're not able to, break free from your work stuff, and if you don't have the money for the airfare and so on, you'll be able to get a taste of the meeting with a much reduced virtual registration for the meeting. I hope some of you really will be interested in this. It's a very, very strong group. So can people hear me okay? My talk today is on Chestnut Lodge, Michael Woodbury, and Cold Wet Sheet Pack. He was the lodge doctor who focused most clearly on what is happening when the patient is in pack. Chestnut Lodge opened, oops, I didn't do this right. Okay. Opened in 1910. Its first owner and medical director, and the only doctor, was Ernest Bullard, MD. Here's a picture of him in his middle age. He worked 7 days a week. He took no vacations in the pattern of the many sanatoria directors of that era. Small residential hospitals were located in almost every community, serving as rest cure facilities, early spas for worn-out people. Most of these sanatoria closed in the wake of the Flexner Report, which focused on medical schools. It documented the very wide range and quality of these various schools. Flexner's report also came out in 1910. So here's you get a sense of this guy. He was very the word precious is coming to mind. He was very thorough. He was very sure of himself, and his report is actually a fun read. He'll be impressed with one school and the quality of the teaching and the clinical experience, and the next school he visits, he'll talk about the lab. It was dirty, my feet stuck to the floor, things were so sticky. There were dirty test tubes in old cigar boxes, etc., etc. Some of the medical schools he found gave the students no clinical experience whatsoever, whereas others would have lots of clinical experience with close teaching as well. So what happened was that people in general really focused on how doctors were being trained, and very many medical schools either closed or melded into the schools that were given higher ratings. That look at the profession then spilled over into looking at these sanatoria. And very many of those closed as a result of the Flexner report, even though the Flexner report didn't look at them directly. Ernest Bullard had been a professor at Northwestern Medical School, and he ran into trouble with Robert La Follette, who was a very famous governor of the day. La Follette wanted to hold political gatherings from time to time on the grounds of the hospital, which was located up on a hill overlooking Lake Mendota. It was the Mendota State Hospital. So he asked Bullard, would it be all right, and expected him to dutifully say, yes, Governor, it would be fine. But instead, Bullard said, I think that would interfere with patient care. And La Follette said, look for another job. So Bullard packed up the family and headed to the East Coast. He looked up and down the East Coast and decided that Washington would be his best bet, and said, if we ever have a big depression, an economic depression, the federal government will look after itself first and everyone else second. So he located the Woodlawn Hotel. The owners had gone bankrupt towards the end of constructing the building, so it had never functioned as a hotel, and it needed further work to become a complete facility. He invested in that, and the family lived on the first floor of the hospital, and patients were housed in the upper 3 floors, gradually filling the place. When he was there, he immediately affiliated with the medical schools in Baltimore and Washington. And so when the Great Depression hit, the hospital was secure and in fact functioned right through that setback. So the hospital survived not only the Flexner report, but the Great Depression. I'm messing this thing up here. Okay. I've got a touch screen here, and I shouldn't be leaning on it. So when Ernest Bullard suffered a heart attack, thanks. His son Dexter Bullard, who had become a psychiatrist, returned to the lodge. He was in his residency in Hawaii at the time. A few years later, he became the hospital's second medical director in 1931 when his father died. Dexter Sr. had grown up with the hospital's patients, who had served as his babysitters and with whom he had played croquet and gone on walks. When he became interested in psychoanalysis, he was struck by the commonality of the dreams of the neurotic patient and the psychotic productions of the patients. He felt strongly that psychoanalysis, with its emphasis on dream interpretation, would be a valid organizing principle for his hospital, which would then have a unique specialization. He was in his training analysis in 1935 when his analyst got a call from Erich Fromm, asking if he could help his former wife, Frida from Reichmann, find employment. So you can see Frida in front on the left here with the staff. Dexter Bullard is the guy with the part in the middle, kind of in the middle of the picture. I'm looking for Otto Will, should be in the picture somewhere. That I think that Otto Will is is second from the right in the middle. Martin Cooperman, the two of them went up and got Austin Riggs on an analytic track working with psychotic patients. But that was later. Then this picture, you can see Frieda from Reichman in the front row. Otto Will is over seated on the far left, to your left. Donald Burnham wrote a wonderful book. Dexter is sitting in the middle picture next to, from Reichman. Harold Searles is seated at the far right. So that was like the core crowd in the golden years of the place. So anyhow, Dexter Sr. was lying on the couch, and his analyst asks him, can you use a German Jewish refugee? Dexter says no. A couple of weeks later, he asks again, no. Third time, all right, I'll interview her. Well, when he met her, he immediately saw that she was exactly what he needed to actualize his dream of creating a psychoanalytic hospital for psychotic patients. She was fluent in English. She loved to teach. At the hospital where she had trained, run by I.H. Schultz in Dresden, the doctors would accompany the rich patients to the opera or the theater, and she hated doing that. She said, couldn't I please do the lectures to the patients and not go to the opera? And she had published some 20 papers in German. She really was a great, very warm, but very strong presence. And he said it was love at first sight. And she had worked closely with Georg Grodek, whose sanatorium is located in Baden-Baden. She would kind of do the hostess work for his symposia. The hotel is now, his sanatorium is now a small hotel, and I stayed there some years ago, staying in the room where Sándor Ferenczi stayed when he visited his friend there. The solemn guy with the cigar is Grodek. The warm guy with the smile is Ferenczi. They said about Ferenczi, you could bring a sick horse to him and he'd be able to heal it. Very tender guy. Very creative papers. That was kind of her crowd. She had graduated from the Berlin Psychoanalytic Institute and had worked in Germany's only psychodynamic hospital, Weißer-Hirsch. I stayed in the room where Ferenczi would stay, and the room at Nantes, the guest room, has a balcony on it that was almost the same. It was the same flavor as the hotel that was Grodek's sanatorium. So I felt there was this real connection here with that facility. Von Reichman was a charismatic speaker, and the lodge waiting list grew very quickly for both patient admissions and staff applications, with a waiting list of 2 years. So there were families that wanted their patient to have an analytic approach rather than the ECT that was being encouraged, and people wanted to train there. so that both those groups were waiting 2 years for a place to open up for them. When Frida went to the Menninger Clinic in Topeka, Kansas to give a lecture, Carl Menninger tried winning her away from Bullard, and Bullard countered, telling Frida that he would have a home built for her on the grounds of the lodge. Bullard could see the cottage from his office, and the staff remembered feeling that Frida was living in a fishbowl, with Dexter keeping an eye on her. I mean, that's this, somehow, that Searles is late. Where is it? How did we get... Okay, this is Searles. This is out of order. Here we go. This is the one I wanted. This is a picture of Frida when she arrived at the lodge, about 45 years old. The guy is Eric Fromm, who was a prolific writer. The falling out of that marriage had to do with having kids. She really had loved OB/GYN. She would have been an obstetrician, but she was only 4'10" and felt that she was just too short to handle the deliveries. Eric Fromm was a prolific writer who did not want kids because it would interfere with his writing life. So they parted ways during the time that he was suffering from tuberculosis and was in Davos, Switzerland. So here is a picture of her cottage, which is still standing. Most of the buildings at the lodge were torn down to make room for a pseudo-Victorian development of houses, and the main building burned in a fire we all thought had been set by the new owners because they were trying to sell each floor of the hospital separately for $1 million each, and they just weren't moving. The building was just too old and needed too many big repairs. Frida's book, Principles of Intensive Psychotherapy, became required reading for essentially every mental health professional training between 1950, when it was published, up through the early 80s, when the big pharmacologic push began in earnest. I wonder how many of you have taken a look at that book. It's a little paperback book. Got one hand went up, two. But it really dovetails very, very well with working with a person who is in PAC. And the essence of it is knowing yourself and working very hard to eliminate or as much as possible your own defensiveness, but letting yourself be naturally and honestly there with your patient, because a patient in psychosis can sense that defensiveness immediately. So the productivity of the staff was extraordinary. Not only did von Reichmann produce a standing room only audience at her lectures at the American Psychiatric Association, the younger staff members were in many cases more prolific. The works of Harold Searles, and this is a couple of pictures I took of him, brought many psychiatrists, myself included, into specializing in psychodynamic work with patients suffering from psychotic conditions. His self-awareness and his courageous honesty set a high standard that I don't think has yet been equaled by any subsequent writers on the human condition. Again, have any of you read any of Searles's papers? It really is astounding how open he is about what he's thinking and what he's feeling in the specifics of the interactions with some of these very regressed patients. Pingney Powell's book on schizophrenic reactions, Donald Burnham's book, The Need-Fear Dilemma, Stanton and Schwartz's monumental research on group processes in the mental hospital. The book is called The Mental Hospital. And Clarence Schultz's Case Studies in Schizophrenia, where the work in that book, even though it looks as if it was done at Shepherd Pratt because he had moved there as a staff member at the time that book was published, all of those cases, that work was done at the Lodge. And Ken Artis's work on group process was done there. And these were just a few examples of the landmark work pouring from the Lodge in the 1950s through the 70s. There were seminal papers on delicate cutting, on suicidality, on the borderline condition, just to name a few important areas. But the book that got the most notoriety was written by a patient from Reichman, Joanne Greenberg. She was 16 when she arrived at the Lodge and was the first teenager to be admitted. And she had been psychotic since the age of 8. So the one building that housed patients at that time was the main building. So that's pictured on that's the building that went up in flames in the months just as the hospital was closing. So her book, I Never Promised You a Rose Garden, is a fictionalized autobiography. The doctor in it is Dr. Fried, and you really get a sense of that work. Frida wanted to be a friend of hers after the completion of the work. And Joanne invited her to her wedding, but she was not up for having her come visit her at her apartment, etc. So she set a limit that Frida wasn't able to set in that relationship. Frida had trouble letting go. Her 1968 autobiographic novel describing her treatment and recovery has sold well over 10 million copies. And there was a movie that came out years ago. It was set in Southern California, so it's very different from, you don't get a sense of what the Lodge looked like from that movie. Ruth Litz, Theodore Litz's wife and fellow analyst, commented, actually, when I worked in Swiss hospitals in the 1930s and later at the Phipps Clinic in Baltimore, the doctor had his office on the ward and was available at all times during the day and sometimes in the evenings as well. And if a patient suddenly became excited or aggressive, he would be put in a wet pack and the doctor sat beside him. As the patient sweated and relaxed, he might be able to explain to his therapist just what had upset him. Both the patient and doctor would learn from the experience and gain new insights into the patient's sensitivities. That was all a quote of Ruth Litz. I'm guessing that Frida from Reichman introduced PACs to the Lodge in the late 1930s, but I don't have any data on that. Josephine Hilgard, another psychiatrist working there, discovered the anniversary syndrome. Something upsetting happens, a parent dies, there's some other calamity, and a year later, or maybe 5 years later, there'll be a dip in the person's mood or integration, and it isn't clear why. If you ask the patient, can you think back to what happened around this time in past years, the patient will usually be able to connect the trauma with the mood, something that he or she hadn't been able to do without that question being asked. She gave a following illustration. I learned that to communicate with Mary, it was necessary to wrap her in a cold pack because she would be so out of control that otherwise she could not be reached. Even in the pack, Mary would continue to shout until her shouting wore itself out. Then her attention would focus partially on my voice. What did I talk about? At a loss as to how to proceed, I recalled that I told stories. One was about a child who was alone on a mountain trail where she met different small animals and befriended them. I tried to think of calming stories about animal friends because Frida had suggested that they would be more acceptable to some disturbed patients than would people. But the best description of the healing power of the cold wet sheet pack came from a patient herself, and that is Joanne Greenberg. In her interview with Laurie McAfee, a friend of mine that I cajoled into taking a job at the lodge, Joanne described to Laurie her first experience in PAC. She said, I was on main 4. That's the floor just under the mansard roof of that picture. I was on main 4 having a very tough time. A doctor, whom I don't remember, since I subscribed to the theory that if you've seen one person, you've seen them all, said, I think you need to be in one of these. So he put me in one. I think it would be a bad idea for anyone who was claustrophobic to be in a cold pack, but for me it was the first time I was ever able to look down into my mind, to get clear, to be clear. Once that happened to someone who had never had that, I think he would do anything on earth to get it again. That kind of stillness had clarity. All that yelling that went on all the time inside me wasn't there, and I was at the end of it. You're not going anywhere. You're not going to hurt you or it or anything. That's all. That is it. You can fight and fight and fight. I knew that the ability to stop dead and look inside myself was what well people have, and I knew that that high feeling in the pack was coming from me, not a drug. I learned for the first time that there's a difference between inside and outside, and that inside then became available to me. Once I saw that, once I learned that, I would do anything to promote it. And end quote. This is something of what my patient experienced, not so clearly and dramatically, but that containment, that taking action out of the immediate equation gave room for thinking to take the place of impulsivity. It gave patients the opportunity to speak from their hallucinated states. For my patient, who I'll talk about tomorrow, I was literally her parents as she pleaded with me not to have to go to Sunday school that day, a voice that sounded like a 7-year-old. And then she abruptly switched to her panicky experience of seeing her pet goldfish flapping around on the floor of her childhood bedroom. These hours of relative security when she was in PAC gave us the chance for a very fundamental connection. And this was after she had made an attack on me in our first meeting, something that caught me completely unawares. She had also tried to run off the unit it was on the 3rd floor, trying to get out to the main street and to throw herself in front of a truck. So having those initial hours where she was routinely in PAC let us recover from her assault, let me recover from her assault, and let us gradually get down to work. So finally, I'll tell you about Michael Woodbury. Here. He was born in Dole, France, tiny and ancient town in eastern France, also the birthplace of Louis Pasteur. It's 131 kilometers or 81 miles from here. Woodbury was educated in France as well as in the United States. He was a biochemistry major in his undergraduate years at Harvard and later attended Harvard Medical School. He then became a psychiatrist, training at the Federal Hospital St. Elizabeth's in Washington, D.C. He then joined the Chestnut Lodge staff in the late 1950s and was there through the early 1960s. From Reichman died on April 28, 1957. Coincidentally, Chestnut Lodge closed on April 28th in 2001. In any case, his time together with Frida was not very long, but I'm not sure whether the person in the group picture, I can go back to slide 4, is Woodbury. On the guy standing on the far right is the guy that looks most like Woodbury but may not be. In any case, Otto Will and Harold Searles and most of the others who were drawn to the lodge by Frida were still there for the duration of his time at the lodge. After working at the lodge, Woodbury traveled to Africa and worked with Albert Schweitzer. He was impressed by how Schweitzer kept the families involved in the treatment of the patients. Woodbury returned to Africa several times, and this launched his interest in transcultural community psychiatry, and he visited psychiatric facilities throughout Europe, Africa, Puerto Rico, Cuba, and the Indian reservations in the United States. He launched psychiatric services at Rive de Prangin. How do you say it? Is that close enough or no? Okay, thanks. Rive de Prangin. Almost due west of here, also on the shores of Lake Geneva. His reports state that he did introduce cold wet sheet packs there, a modality for which he had become a strong advocate. On reading his brief published report on that project, I was pleased to read, quote, "Our basic hypothesis is that the mode of relating of the various members of the team, the affective field they produce, is the unifying, synthesizing factor in the treatment of the individual patient. It is the integration of the healing team which in large part causes the patient to reintegrate." I was astounded to read, quote, "Furthermore, we have utilized as therapists under supervision patients who had developed their skills mainly through the psychotherapy of their own illness. At Prangin, we have developed a method of team psychotherapy to train co-therapists." Unquote. There was a huge emphasis on regressive body image with the documentation of reintegration done through the patients doing a draw person image, which was supposed to represent themselves before going into PAC and then coming out of PAC. And they were in PAC longer than what's generally being done at the hospitals now. It was more like 2 to 2.5 hours. And the pictures really are, so here's the before and then after. So that what's most striking is that in the first, the person doesn't have a boundary. They're bleeding out into the world. I think this is the primary helpful thing of the cold wet sheet pack experience, that they will have often for the first time a psychological skin. So to have a psychological skin means you can have angry feelings, murderous feelings, and you can hold them. You can know these are my feelings. I'm feeling them in me. They're not spreading like viruses into the surrounding. They're not infecting the other person in the room or the person I'm thinking of. They're just in me, and it's okay. So you can see that the after pack person has a skin. Here's another series of before and after, where in the first there's hardly a complete face, and you're looking at something more robot-like than human. But the picture on the right has a feeling of being a self-portrait. And the last one in the series, similarly, a pretty profound change over the course of 2.5 hours. Primitive stick figures before pack, interesting caricatures directly after being in pack. So I was curious about the family connections between Nantes and Prangan. That is, are there current staff at the hospitals who have worked there or whose parents worked there? Are there staff members who actually remember Michael Woodbury? Is there an ideologic family bond? Woodbury also launched a community center in the 13th arrondissement in Paris, where he and his psychiatric social worker wife, Margarita, launched their healing team concept, a concept that grew from his research that he did at Chestnut Lodge. His work in Paris, however, involved treating the patient in crisis in the patient's home. The patient then had access to the community center at any time of the day or night as needed. He also launched the Still Functioning Psychiatric Institute in Washington, D.C., the Knut Hansen Hospital in St. Thomas, Virgin Islands, and the Centro de la Comunidad Mental in Puerto Rico. He spent his last 30 years in Puerto Rico serving as executive director of the Commission of Mental Health for Puerto Rico. He continued his private practice until age 83 when he retired. And I'm not sure, I think he's died, but I'm not positive. At the time of his lodge research on ward group dynamics, he wrote in the summarizing research, quote, "The most important role of the ward administrator is not to teach, to lecture, to reveal an external truth or a set of principles, but rather to support the self-esteem of the personnel in order to develop the healing qualities of their selves. He can accomplish this task by accepting the role of model and attempting to demonstrate in the group meetings an attitude of openness, polyvalent feedback, trust, and respect for the other person's decision-making capacities." He said, quote, "In my opinion, withholding a human response on the spot is much more devastating than one determined to be wrong hours or days later. If the ward is to be a deeply human experience for all members of the community, we cannot have a monopoly of roles whereby the doctor gives the orders, nurses provide care which the patient absorbs without returning the care, where personnel are self-controlled and inhibited, but the patients are free, if not encouraged, to express themselves. This atmosphere parallels too much what I have experienced in working with schizophrenics' families who feel that the patient is too weak, too inexperienced, too delicate, too ignorant, too traumatized, too crazy to deal with other human beings on an equal basis. This overprotective attitude is what leads families and some personnel to distort reality and human reactions for the, in quotes, benefit of the patient, and with best intentions, but distorts nevertheless. The safety valve that we offered personnel during era 3 of the study was support for the full expression of their feelings, which we deemed to be of considerable therapeutic importance for the patients." Unquote. He concluded his report by saying, "Finally, the following points need special emphasis. It takes a minimum of 2 people working closely together as a team to heal the schizophrenic's core pathology, his split object and self-representation. I think that I hadn't realized that much of the work now with PAC has 2 staff people with the patient who's in PAC. I thought that was very neat support from an earlier era for that procedure currently in place. He said, for healing to be possible at all, the patient must externalize his pathology. Thus, splits are to be considered an integral and necessary part of the treatment process rather than nuisances to be prevented or avoided. Physical contact is deemed to be crucially important in the treatment of chronic regressed patients as well as those suffering from acute panics. He concluded, life on a ward community can be one of the most intensely absorbing human experiences. The healing process causes a bond between people who work together, which makes up for the emotional wear and tear to which one is submitted. When the patients are allowed gradually to participate as full members of the treatment team, some regain an interest in people and groups which they had lost long ago. This simply is the message of this presentation, end quote. So what we're currently thinking about for a future project is the possible launching of a Michael Woodbury Fellowship for someone in training in mental health who would be learning about PAC, who would be learning about group process in hospital work, and doing insight-oriented therapy or formal psychoanalysis. And hopefully his name will be remembered. His daughter, Camille Woodbury, is a psychiatrist and psychoanalyst now living in a rural part of Maryland. She's an adolescent psychiatrist. She has the same warm personality as her dad, and I'm hoping that if there is a Michael Woodbury Fellowship, that Camille would be out there to present the award to the first person granted it, and that some of you would then get to meet her and have a sense of what Michael Woodbury was like. One other thing that I didn't put in the paper, but as I'm giving it, I realized it should be there, is one of the things that he did in Paris was to work with a beauty parlor or salon or spa, so that they offered, along with steam baths and massages and whatever the person wanted done to their hair, they offered cold wet sheet pack. And the reason that they did that was that coming out of PAC and having that feeling of self-containment and the warmth that comes through from that, that the person looks like they're in love with life. They're smiling, they're walking with a lot of confidence, and that's the essence of what attracts the other person. I want that person in my life, because if she's able to do that for herself, maybe she'll be able to do that for me too. So that's what he identified as the essence of beauty. And I think that if that could be duplicated along with the PAC being done in the hospital, you develop a group of advocates, people who can't wait for their next appointment to have their cold wet sheet pack at the spa, are going to be saying, it's not barbaric, it really is great. And that would help not to get into that trouble that people suffered when autistic kids were put in PAC and the parents reacted as if their kids were being tortured at the hospital. So thank you for your attention.